Hello, I'm Jack Kelly, and welcome to SativAcademy. In our last episode, we looked at specific ballot initiatives that have been proposed in different states that are designed to weaken cannabis laws or eradicate them altogether. The purpose of that episode was to highlight specific movements directly dealing with outright legalization. The legalization movement has seemed to focus on two different things. Some folks want the prohibition on marijuana to be eradicated altogether, while others simply say that it should be legal, but only for medicinal purposes only. Well, this is where our focus will be today as we examine how marijuana benefits people, specifically dealing with cancer. Many pioneers in the legalization movement have argued that cannabis provides an enormous benefit to those people suffering with cancer. But what exactly do they mean? Are these people insinuating that this magical plant has healing properties? Or are they simply saying that the effects of it on the human body provide relief? This is a great question, so let us look at some facts. What we do know is that the natural effects of the plant do provide obvious benefits for the human body, such as a numbing for pain relief and an increased appetite. These effects are not simply things only used for pleasurable activities, but can and do enhance the lives of people going through all phases of cancer treatments. So how does the effects of cannabis that I just mentioned really provide relief for those patients? Well, first, we must look at what cancer actually is and how it is caused. Something causes cancer cells to divide and grow without pause, spreading badly damaged DNA. Those cells invade other tissues and, in most cases, form tumors. These tumors will continue to grow and spread unless they are stopped. Now, here lies the biggest problem. How do you stop cancer from spreading? Well, if we knew the answer, then we could save millions of lives, and I'd be a rich man. Currently, typical treatments for cancer involve a process of what is called chemotherapy. Chemotherapy, although sometimes quite effective, is less than an ideal approach to alleviating cancer. The side effects are horrific, and sometimes cancer patients will forego chemotherapy treatment if they feel it is less than a 50-50 chance of survival. For instance, some of the most powerful and toxic chemicals are used in chemotherapeutic agents. Both treatments kill cancer cells, but healthy cells are killed as well. Chemotherapeutic agents such as adriamycin and plitinol can and have caused immune suppression and multiple organ damage, but they also cause severe nausea and vomiting. Many patients, when faced with such a long and painful process, will simply choose alternative therapies that are unproven and can have tragic consequences. Because the treatment of chemotherapy is so painful and psychologically damaging, cannabis has been used to alleviate the awful side effects of chemotherapy treatment. Some of the more severe side effects, like vomiting, can last over a period of days, to the point that some patients have actually torn their esophagus. Due to this vomiting and lack of appetite, dehydration and weight loss is normal. In fact, many cancer patients begin having a reaction before chemotherapy begins in what is called anticipation of the side effects. Unfortunately, although chemotherapy and/or radiation treatment may be an integral part of their survival, many cancer patients decide not to take the therapies because the side effects are so severe and essentially choose the more risky path of no treatment at all. Studies have already proved that some of the side effects caused by chemotherapy and radiation can be offset with cannabis injection. For example, in 1975, the New England Journal of Medicine published the results of a double-blind study on the effects of patients who took an oral pill of tetrahydrocannabinol. The study concluded that oral tetrahydrocannabinol has antiemetic properties and is significantly better than a placebo in reducing vomiting caused by chemotherapeutic agents. Moreover, cannabis can be taken orally as opposed to being ingested through smoking only, and it is the ingredient in the plant that is the most important function here. Another important aspect of this study was people suffering from depression as a result of actually having cancer in the first place have reported psychological benefits. It has also been reported that people who have lost their appetite during treatment have regained it while on a regimen of cannabinoid medicines. This is important because if it can be proved that cannabinoid medicines actually offset these side effects, it's possible more people will get radiation or chemotherapy knowing that the suffering can be reduced. This could potentially save millions of lives. What is even more miraculous is that some studies in the past 20 years have actually shown signs that cannabinoids-related medicines have actually fight cancer itself. Can you imagine this? In fact, it's been shown that cannabinoids arrest cancer growth in many different forms of cancer, including brain, melanoma, and breast cancer. There's even growing evidence that cannabinoids cause direct anti-tumor activity. Now, I want to be clear. This is not a proven fact as of yet, and further studies are needed. But the possibility that this plant could not only provide cancer patients with relief, but maybe even help out in a cure is simply astounding. Well, that's all we have for today, and I hope we've begun a broader discussion. Please go to our blog at SativAcademy on our website, insidershealth.com, for more information on all news and topics regarding cannabis. Thank you very much, and have a good one.